Here at CBS 8, we strive to cover the most important mental health stories and share the key tips and advice that can help you and your family get through difficult times because you matter. We're joined now by Dr. Ankur Bindal, the President and Chief Psychiatrist at KMG Psychiatry. They're the sponsor of our You Matter series. Dr. Bindal, thank you for being with us today.
Glad to be here.
First, for our viewers who aren't as familiar, what's the biggest difference between psychiatry and psychology?
Pretty much psychiatry are the MDs or the DOs who are practicing medicine. So there's a lot of medication management along with the therapy by the psychiatrist. Psychologists are mainly talking to the patient and giving them tools and resources without using the medication management.
We've grown a lot in our knowledge base over the last couple of decades, public awareness, but there's still a lot of misinformation and misunderstanding. What are the most common, most persistent myths that you encounter maybe daily in your practice?
Absolutely. Mental health in general, I mean, the basic stigma out there is people with mental health are weak. It's a sign of weakness. And it's not a sign of weakness. A lot of times, I mean, people think the treatments don't work, or these folks are just crazy, quote unquote crazy, and the mental health is a permanent condition. There are treatments out there, and we need to break the stigma and the shackles around it.
So letting people they can get well, letting people know it's a process.
Absolutely.
So things are changing daily. The world is a complicated place. So much technology emerging in the last 15 years. What are some of the emerging concerns that you see in your practice? What are things that have your radar going off?
Well, absolutely. Well, when you talk about concerns, Carlo, I look at the positive strengths and the positive direction mental health is going into. And one of the ways I look at psychiatry is use of non-medicinal approaches in addition to therapy. And one of them being transcranial magnetic stimulation, which is a magnetic field-based treatment which is out there. The increased use of nutrition, the diet and the nutrition, and understanding the importance of exercising, eating healthy, in improving your overall mental health awareness.
So it's a holistic approach. It's learning more about the total patient and moving forward with that.
100%, absolutely.
What are the big questions out there in research that we're trying to answer to provide even more answers for people dealing with mental health issues?
100%. So the research questions, which I would say might differ from different individuals, but I am more of a holistic psychiatrist. So I tend to actually look into psychiatry as an overall 360-degree human wellness. So the basic research questions occur mainly in terms of epidemiology, the genetics, the epigenetics of the patient, cross-cultural components, expanding the use of transcranial magnetic stimulation to include more indications.
We're almost out of time, but I do want to ask you, we have a large military community in San Diego. Absolutely. What do we need to do to make sure we maintain or improve access for our veterans and active duty?
I mean, they're basically two things: increase awareness, increase accessibility. A lot of times, we need to make sure we break those shackles of stigma and mental health, address that ambivalence surrounding the mental health, and improve the accessibility to the healthcare professionals in the community as well. Whether it's in terms of using digital marketing, digital access, or decreasing the wait times in the mental health as well.
Kind of circles back to your first point about mental health isn't a weakness, a lack of character, courage, or whatever. Absolutely. It's something we're dealing with, and when you're in the service, it's the same thing. Dr. Ankur Bindal, thank you so much for your time. KMG Psychiatry, sponsor of this segment. We appreciate you, and hopefully we can get you on more and talk about more specific approaches to mental health.
100%.
Thank you so much for your time.
Good to be here, Carlo.